Hello everyone, and thank you for joining us today for the webinar on managing mood, exercise interventions for depression. My name is Catherine Sabiston, and I am a professor in exercise and health psychology at the University of Toronto. I am also the director of the Mental Health and Physical Activity Research Centre in the Faculty of Kinesiology and Physical Education at the University of Toronto. So before I begin, I just wanted to make a few acknowledgments. First of all, I wanted to acknowledge the work that CanBind is doing and in terms of the team working on reducing the impact of depression and its treatments. I also wanted to acknowledge the partnership with the Ontario Brain Institute and the Canada Research Chairs program for the work that I'm doing in this area around physical activity and mental health. To give you a brief outline of what we're going to talk about today, we're going to look at vital exercise approaches to mood disorders. We're going to look at some key online tools for exercise and how to present exercise strategies to patients. And hopefully these strategies will come through throughout the webinar today. So just to begin, I wanted to highlight the role that physical activity plays in health promotion, and in particular with a lens to mental health. So first of all, we know that improvements in mental health are seen through physical activity or with physical activity. We also see that physical activity is related to the prevention of poor mental health and illness. We see that physical activity shows improvements in quality of life for individuals with mental illness, and also that physical activity can be a treatment for mental illness. So when we look at the other aspects around physical activity, or flip it around and look at physical inactivity and what's related to physical inactivity, we see a whole host of diseases and illnesses that are related to low levels of physical activity. And if I draw your attention to the right corner, one of those is the psychological disorders. And in particular, what we're talking about today, the mood disorders and depression and anxiety. What's important here is that individuals who present with psychological disorders are then at higher risk for a whole host of additional health comorbidities, and this is the real challenge. So you can really see the cyclical nature of physical activity and psychological disorders or mental health more generally, that if we can improve mental health and if we can improve physical activity, we can improve mental health, and we can improve a whole host of additional health conditions or comorbidities associated with it. So with this in mind, it's important to look at what we're supposed to do. What are the levels of physical activity that are related to the health benefits? And for this, we do have guidelines that have been integrated and introduced, and specifically the guidelines range from for children and youth. What we see is that physical activity levels should be around 60 minutes of moderate to vigorous intensity physical activity each day, and that activity should include vigorous intensity exercise as well as activities that strengthen muscle and bone. Now for adults, the guidelines suggest that physical activity, that there's about 150 minutes of moderate to vigorous intensity physical activity that's done each week in bouts of at least 10 minutes. And also there's benefits to muscle and bone strengthening activities using all the major muscle groups, and this should be done around for 2 days per week. The only difference in the guideline for older adults over 65 years is to also incorporate activities and movements that help with balance. So these are the general guidelines for Canadians. And so we want to know now, what are Canadians actually doing? So what percentage of Canadian adults are meeting these guidelines? And the literature, one of the sort of foundational articles that was published on this topic by Rachel Colley and colleagues demonstrated that Canadians are far less active than we even sort of knew based on self-report levels of physical activity. And so these data were presented based on accelerometer, meaning that individuals, participants in this study, were asked to wear an accelerometer, which is a small device that's worn either on the waist or on the wrist, and that measures activity counts. And those activity counts are then transformed into values that connect with levels of physical activity and intensity. And so what we can see based on the measure of physical activity is that 15% of Canadians are considered to be sufficiently active based on comparison to the guidelines that I just presented for you. And this is far lower than what we tended to see by self-report, which is that about 50% of Canadians would report that they're engaging in sufficient physical activity for those health benefits. What I also just want to draw your attention to quickly on this slide is that men tend to be more active than women, and this is sort of consistent across the lifespan. We also see that as individuals age, that physical activity levels tend to decrease. And we also see that based on weight category, that healthy weight individuals are more active than overweight or obese when these comparisons are made. So those are just general trends based on the information that we have, demonstrating that very few Canadians are ultimately exercising at levels that are conducive to health benefits. Now, just to highlight a review study that was done on individuals with major depressive disorder, what we see is that those levels of physical inactivity are more consistent with 68 to 86% of these individuals are not meeting physical activity guidelines. And this was based on a report, a systematic review of 24 studies with 2,901 participants. So the lower levels of physical activity were seen in those individuals who were measured, with measured physical activity. So again, the accelerometry measured, whereas self-report was sort of on the lower end of this 68%, I guess you could say. So generally speaking, individuals with major depressive disorder are much less active than controls in this review, and these values are much less than what we saw with Canadians, or consistent, I guess, with Canadians. So what are some of the reasons for low levels of physical activity? Now, broadly speaking, the reasons for low levels of physical activity are quite consistent across the lifespan, across men and women, and across different clinical populations that we have explored more generally. And if I summarize these, I will sort of just take a humoristic approach to this, but suggest that the common barriers are generally too tired, too little time, too much pain, too old, too healthy, too little money, too few friends, too little motivation. And really, if we go through this list, what we're talking about is, too tired, and time is always one of the common barriers. Individuals, depending on the groups that we work with, too much pain, or just age in general, so it's too late sort of to exercise. We also have individuals who say they're just too healthy, they don't need to exercise. The cost associated with physical activity, the social benefits of physical activity are well known, and individuals tend to say, I don't have anyone to exercise with, and that's one of the common barriers, and motivation as well. So we'll cover some of these barriers in a minute. I also did want to highlight, though, that in addition to these common barriers that we see in general, what we also see is in individuals with mental illness or presenting with some level of mood disorder, is that there's also these added elements or symptoms, I guess you would say, that are common additional barriers to exercise. And these include a loss of interest in most activities, lack of energy, feelings of guilt, and negative affect and emotion. So these are the additional symptoms that we have to be aware of when we're working with individuals around exercise in this capacity. So the first main barrier that crosses sort of all levels is time. And ultimately, the key here is to identify to your patients and clients that time is essentially doesn't have to be a barrier. Really, it comes down to the fact that any exercise is better than none. And we really want to also highlight that there is this component of lifestyle activity that can be incorporated into one's day that is not the sort of traditional physical activity that we would consider to be treadmill running or running, biking, swimming type of exercise, that we're really talking about moving more and making small changes to one's day to be able to incorporate exercise into one's day. And it's really sort of captured in the quote that I have at the bottom here, that you could start to sort of have that dialogue with patients or with clients. And so, ultimately it's about asking about their day and what happens in a day, and whether there's times that in the day that they could be more active. So are there times when you choose the fastest or the shortest route or the easiest route, and when does that happen, and sort of get a context of when in the day physical activity or exercise could be a little bit more incorporated throughout the day. And there is this concept of Dr. Levine has suggested that this idea of non-exercise activity thermogenesis, or the NEAT principle. And what this suggests is that, generally speaking, moving more throughout the day, you expend more energy, and that ultimately helps counter a lot of the negative health implications or illnesses that we see. So we'll go through a couple of these. A couple of suggestions just for time is to, work with individuals to change workplace routines to be more active. So instead of meeting for coffee and sitting down, is to actually take the coffee to go and go for a walk. When commuting, to use the commute to actually incorporate more activity. So if I think I have a couple of, or at least one slide on the next slide that demonstrates how you could use the subway to improve your commuting behaviors, but ultimately biking or walking or getting off the bus a stop early, or staying on the subway a stop later, so that you're sort of incorporating a bit more walking is very helpful. And in general, just any time that you get together with someone or need to communicate with people at work, that it's done purposefully walking around rather than sitting or using the internal messenger system. Also, just changing lifestyle. So parking the car further away from wherever you're going, walking places, taking the stairs instead of the elevator. Those are all sort of coming to be known as some of these lifestyle changes that can be done to incorporate exercise in one's day. There's also, reminders to stand up. So, we're not focusing today on sedentary behavior, but I will highlight that sedentary behavior research is starting to emerge as sort of this separate behavior from physical activity. And it's this link between being active as well as being less sedentary that has, sort of the strongest impact on mental health. We also use, there's apps on phones or timers that can be set in order to remind people to stand up or to move a little bit. I have the identification of water bottles there just to show that if you're using a water bottle, you could start the day with a certain number of elastics wrapped around that water bottle, and every time you make a choice to move, take one of those elastics off of the water bottle, and that's sort of like your indication that you're doing something. It's actually a self-monitoring tool that works really well and that really costs no money. Paper clips as well you could use, so you could start the day with a certain number of paper clips in your pocket in one side of your pockets, and then as decisions are made or as one moves more or takes the stairs instead of the elevator, those kind of decisions, you can move a paper clip from one pocket to the other, and at the end of the day count the number of paper clips that are in the other pocket. And again, it gives you that visual or that self-monitoring tool that can be useful to help individuals see that it's easier than one thinks to incorporate exercise or activity throughout one's day. This is a map. I always thought that this was a great idea, so I'm glad someone did this for me. But generally speaking, there's maps now of the subway systems in Vancouver, Montreal, and Toronto, as well as probably elsewhere. But the idea of this map is to show you that if you get off the subway a stop early or a stop later, these are the distances in minutes that it takes to walk between those different stations. So helping individuals see that there's a bit of time that you can incorporate into your day just by staying on the subway or getting off early or staying on later throughout the day. So little strategies to incorporate more activity. And I'll just demonstrate this for you, the idea of the NEAT principle, or the non-exercise activity thermogenesis principle. And if you see on the y-axis here, this is sort of our energy consumption, and along the x-axis is the time during the day. So I'm going to put up two simulated profiles for you just to demonstrate the value of moving more or incorporating more movement throughout one's day. The first person here is someone who would traditionally be seen as meeting physical activity guidelines. However, they sort of sit, eat breakfast, commute into work, sit at a desk job or sit at a desk for most of the day, go for the 30 to 45 minute run at lunchtime, come back and then sit for the remainder of the day, sit back at the desk, get back in the car, get home, sit for dinner, and sit while watching TV or working at night, let's say. So this person here would be someone who meets the physical activity guideline. Now, this other profile that I'm putting up is an individual who just adds more movement throughout the day. So still sits, commutes to work, but gets up from the desk more often, stands at one's desk, moves more, gets up and talks to colleagues, never really goes for any substantial amount of exercise throughout the day. However, consistently incorporates more movement and more activity throughout the day. And the key here is that the individual that's depicted here in orange is actually expending more energy throughout the day. The area under the curve is larger for this person than for the person who actually meets physical activity guidelines. And so, generally speaking, if we can work with individuals to incorporate more physical activity into their day, this is helpful for mental health and health benefits more generally. And you might be thinking now that, well, this isn't the type of activity that was just incorporated or just mentioned in terms of the physical activity guidelines. And I will say at this point, if I don't say it again, is that especially for individuals who are starting out to exercise, but at any level, it's really important that people focus on the type of activity and the amount of activity that is feasible and that can be done, without setting sort of limits that help set them up for failure. And so, the Canada Physical Activity Guidelines are there as a guide. However, they are not conducive to individuals who are just starting, because ultimately it's a very hard guideline to be able to reach, especially at first when you're starting out. And so we have to be able to build confidence and build efficacy to then incorporate more activity, and that in turn will lead to engagement in more and more activity. However, if we start at such a high level, individuals tend to feel like they can't meet those guidelines and then stop or sort of consider it a failure. And that sense of failure then reduces levels of competence and efficacy, and it ultimately is a spiral whereby we're not ultimately helping anyone in that condition. So what we want to be able to do is help offset some of these barriers for physical activity, while also taking into consideration that people have to start. You have to start small and build capacity for physical activity. So the next barrier that we often talk about is that physical activity is boring, or that it's not enjoyable. And ultimately, enjoyment is a key predictor of physical activity. It's it's hard to start something if you don't like it. it's also hard to keep doing something if you don't like to do it. I often say that we're all adolescents at heart. We don't want to do what we don't like to do. So it's key here to find those exercise habits and exercise behaviors that are enjoyable. And this includes things like helping individuals think about different varieties of exercises that they can do in terms of, and exercise can be varied in a number of different ways. So you can change the intensity of exercise. You could go for a walk, and what we often try to work with people is use the environment as a cue. So if you're going for a walk, maybe between different trees that you pass, or between buildings, or between, we used to say mailboxes, but now those are few and far between, as are telephone booths. But in general, if you have something that is a cue to start walking a little bit faster, and then at the next tree or mailbox, slow it down and continue to do that. So have different cues in the environment that help change up the intensity of walking, for example, and that incorporates a little bit more intensity. The different types of exercises is also key. So changing up, not only always sticking to the same type of exercise is critical, and the frequency. So, engaging in different frequencies of different activities throughout the week is another way to change up the routine. The other key thing that we know is to help individuals solicit support from other people. And, this can go in any direction. So it could be, depending on what the individual wants, it could be, posting something on social media to sort of gauge interest and support. It could be looking for social support from other people, including healthcare practitioners, in terms of keeping people accountable. And these are all, social support is ultimately critical to engaging in and maintaining a physical activity program. So generally speaking, what we want to work with is helping people try something new, within that something new, try to start a routine with that, and that routine will build confidence to then be able to change things up, add more capacity for more and more physical activity. We also need to think back again to the symptoms of mental health that I mentioned earlier, or under the auspice of barriers, and identify that the ideas or the symptoms around apathy and anhedonia and low affect, lack of motivation, these are all important symptoms that we have to consider around the idea of boring. So exercise tends to be boring or not enjoyable for most individuals, and then we add these symptoms to the mix, and it can be even more important to highlight this idea of enjoyment. And so, as I already mentioned, the guidelines sort of worsen these symptoms of fear of failure and can really offset feelings of competence as well. And we have to start small and help individuals find things that are enjoyable. Lower intensity exercise and those movement strategies are more enjoyable to most people, and also generally more manageable. And so this sets it up as a step-by-step approach to success, with starting small and building, different variety and different capacities, finding things that are enjoyable, getting rid of things in a program that aren't enjoyable, and ultimately setting up for success rather than for failure. We also need to think about physical activity, as I already mentioned, within this different lens. So in addition to frequency and type that we just mentioned, there's a whole bunch of different types of physical activities in terms of that we explore, and I have some data in a little bit to look at different types in terms of sports. So participating in team and individual sports, for example, in the community or at school. But there's a whole host, like different contexts as well. So the sport can be engaged in as an organized sport, it can be recreational, it can be extracurricular, and then within all of these contexts, it's also important to just highlight, again, that just move more. And as I already mentioned, sedentary behavior also is its own separate behavior that we need to start highlighting, reducing sedentary behavior for health benefits. So generally, taking the highlight off of moderate to vigorous physical activity for a while and just starting to dispel that myth that exercise is running, biking, and swimming. And, ultimately, it's really important to find exercise that's enjoyable. Because if you think about it, these pictures are a demonstration of on the left-hand side, medieval torture devices, and on the right-hand side, your sort of traditional exercise machines. And what we can see here is ultimately this depicts the idea that exercise is really not designed to be enjoyable for most. And so it's critical that we focus on finding and helping individuals find what is enjoyable. Just another couple of slides for you. Medieval torture devices on the left, and on the right, a hand dynamometer that measures strength. So just to highlight while we're in this area about dose response. So we often get questions around dose response in exercise. How much exercise is enough? How intense should the exercise be? And really at this point, we don't really know the answer to this question. So the minimum and maximum levels of exercise is ultimately unclear. However, we do know that there are benefits to engaging in a whole host of different types of exercise. So whether it's aerobic or that more cardiovascular exercise, strength training exercise, stretching and flexibility. And the other thing that we do know is that intensity should be individualized. And so, there's often some equations that are used to identify individualized nature of how intense exercise is. We tend to use the equation of 220 minus one's age, which it gives the maximum heart rate, and then percentages of that maximum heart rate can be used to gauge intensity. Also, colleagues in the States have identified that it may even come down to a threshold of lactic acid and the ventilatory threshold that exists to be able to identify intensity and when intensity is most effective for affect and enjoyment of exercise. And just to demonstrate that, as exercise intensity increases, what we see is that Dr. Acknowledgments and his colleagues have demonstrated in this dual mode theory that at early or at lighter intensities of exercise, it's the cognitive factors and self-efficacy more generally that drives the affective brain centers. However, at higher levels of intensity and sort of at or beyond that ventilatory threshold and lactic acid threshold, it's more the interoceptive cues, so the muscular and respiratory cues that drive the affective centers of the brain. And so if we can stay within these lower intensity exercises where we're building self-efficacy and that level of competence really drives how much we enjoy exercise or affect, this is what we're talking about in general in terms of a focus for patients and clients that you may be working with to try to improve exercise. And just to highlight again that physical activity at lower levels is important and has been linked to lower levels of depression and general mood disorders. So this was a study by my colleagues at the University of Toronto at the time looking at systematic review of prevention of depression in prospective studies, so longitudinal studies that were done. And what they found was that walking or gardening, sort of that low-intensity exercise for as little as 20 minutes a day can help prevent depression. So this was promising evidence to demonstrate that the value of lighter intensity exercise rather than the focus on moderate to vigorous physical activity. Okay, another barrier that we tend to see is that individuals are tired, and this is also ultimately one of those barriers that comes with presenting with mood disorders. What we do know is that exercise improves energy levels. It helps people sleep better, and that sleep is more quality sleep. And what we want to be able to do is work with people to exercise when they're least likely to be tired. So identify times in their days when their energy levels or when they feel the least tired. And maybe that's the morning time, which is what we often hear. And so trying to incorporate more movement in that morning period, and then that will demonstrate and that will help improve energy levels throughout the day and help build that capacity to be less tired. Oftentimes, planning for some more movement throughout the lunch hour is beneficial, and then coming back and sitting at your desk or whatever you're doing in the afternoon and eating while being sedentary, but having an exercise bout before. Also planning, so always having comfortable shoes that can be used for exercise, making sure that the plans are realistic, that you're not engaging in something that is far beyond what you've ever done. And this is, again, coming back to the guidelines and making sure that individuals know that to start off with an exercise program, it has to be realistic. We often say to schedule exercise and movement breaks like it's a specialist appointment. We wouldn't ever miss that specialist appointment that you've been waiting for 6 months. So, make it a priority to schedule exercise and those exercise times into one's calendar. And focusing on the small steps that will help ultimately reduce sense of tired and fatigue. And so, again, those small movements throughout the day help people feel more energized and less tired ultimately. Another key barrier that we often talk about is the need for emotional control, or that idea that the talk of failure and like we said earlier, in terms of individuals presenting with mood disorders, that sense of feeling guilty and fear of failure are very strong. And so what we want to do here is focus on positive self-talk around exercise. And so, stopping and reframing thoughts that exercise is boring, or it's not enjoyable, or I don't like it, I don't want to do it, those kind of conversations with the self. Could really stop them by using cues and even prompts in the environment. So having running shoes out at the door or leaving them where you have to trip over them might be, a prompt that could be useful for individuals, or just having statements throughout the house, affirmations, for example, that around exercise, thoughts that one has after engaging in exercise, write them down immediately after and use those as prompts, because ultimately we tend to see that very few people regret going for an exercise session. Ultimately, if you can get out the door, you will feel the benefits of it, and paying attention to those are extremely important. And then another key is motivation, and this is obviously critical for when working with individuals who are presenting with mood disorders. But ultimately, it's important to highlight that motivation is really not just black or white. You don't have motivation or not, and we need to identify why individuals are or are not exercising. And some of the things that we hear around why individuals are considering exercise would be things like to offset drug-induced weight gain, or to look good because everybody wants me to or is doing it, to get the free stuff because it's important and because I like it. And we obviously see more people in these reasons and less people in these other lower level, lower down this list reasons. But this is ultimately where we want people to be. We want people to enjoy exercise. So it's important to understand why individuals are thinking about exercise or why they're not, and highlighting that in with motivation. And we know that to be able to build motivation in our clients or our patients, there's really some key things that we want to highlight. Number one would be competence, and I've said this again and again throughout the presentation, but to be focusing on small, manageable goals will help with competence. And to dispel that myth that exercise is, running, swimming, biking, that idea that exercise can be those small bouts of movement throughout one's day can help build competence. Also keeping track or self-monitoring, like we mentioned earlier, a few strategies to keep track. There's also apps and monitors that can be used to do that. But keeping track demonstrates that one can do it, and that builds competence, and then adding more and more to that will be a competence building cycle. We also want to highlight autonomy and self-control. So by helping individuals change up their exercises, trying new things, trying things that they enjoy versus they're being told to do is critical. Using, as I mentioned already, using the environment to have cues to be able to change up the exercise is important. And we've already talked about self-talk as well, which can be very conducive to instilling a sense of autonomy. And social support is critical. So as also we've already mentioned, but having feedback from other people, having people that can keep someone accountable is important. And also we know from the literature that having a contract is very important to help people stick with an exercise program. So you can find samples of contracts, and we have lots if you wanted to get in touch with me as well, that can be used to help keep people accountable for themselves, for their ultimately for their exercise goals. And many of you are probably aware of the stage of change, Prochaska's stage of change, and ultimately what we want to be able to do is to highlight that we have to match where people are coming in from with what type of information or discussion we have around exercise. So for individuals who are in that pre-contemplation stage or even contemplation stage, what we want to be able to do is offer information. So information on the benefits of exercise, information on, sort of the health effects of not exercising, information related to the efficacy and effectiveness of exercise in the context of mood disorders and mental health would be critical for these individuals. For people who are in the action phase of exercise, what we want to be able to do is help support these individuals, make sure that exercise is manageable, make sure that there's some sort of monitoring, and building that accomplishment or sense of competence is important for making sure that these individuals who are trying and incorporating a few little things to make sure that they continue with it. And for those people in the action phase who sort of the idea of I already do enough, it's really important for these individuals to have a sense of challenge, so to change things up, to add variety, flexibility, and ultimately try new exercises. So this match between what the individual says to you in terms of where they're at on their exercise behavior and what we can do to help them foster exercise into their routines is critical. One of the other barriers that we often hear is that exercise costs money, and especially for individuals, across the lifespan, obviously, but individuals who already have a number of costs associated with treatment of mood disorders. We want to be able to help foster physical activity, and what's critical is that exercise and physical activity more generally doesn't need to cost anything. Ultimately, as I've mentioned throughout this presentation, walking can be, a good exercise for most people. So we can also use just things that are around in the house. So there's a number of different things that we can do to help people think about using what's in their environment to exercise. So, using laundry detergent jugs, for example, or soup cans, jumping over or balancing around different pieces of furniture in the house. We also see that if you're outside, there's a number of parks, and parks usually have kids' equipment in them for that can be used for a variety of different exercises, using hills to change up the intensity, running up and down stairs, doing, leg rises on park benches. These are all, really things that you can use within your environment to be more active. And we have a number of different suggestions for this for individuals as well. But be creative, and exercise doesn't have to cost money. There's also a number of different ways that you can monitor exercise with technology. And so this is Map My Run app, which you can use, and there's also a Map My Walk, where you can basically, at wherever you go, you can sort of create little pictures if you want, like what's on the screen, but ultimately, in a more serious way, it does monitor how far and sort of the pace of activity that one engages in. So this is a neat app that can be used both for fun and you can challenge yourself to create fun little diagrams, or for self-monitoring more generally. Now, I will say at this point, I have a few different ideas in terms of apps that can be used to help people engage in exercise. However, there's no one app that I endorse or that we've seen, works better than others. These are just examples of things that patients or clients can use to help engage in physical activity. So the other is this idea of a book that releases words as one walks. So the more you walk, the more words are released from the book, and you can listen to books while you walk, and as you're walking, the book sort of releases more and more content to it. So you need to walk to be able to ultimately have a sense of what the audiobook is doing. So this is just an example of that idea. The other is the Nike Training Club, which has a number of different exercises, routines associated with doing different levels of exercise, from anything from aerobic to strength training, flexibility, different muscle groups, different time commitments. So there are exercises on the Nike Training Club that are literally 8 minutes long, and they range from that 8 minute or even 5 minutes up to over an hour. So it's just a matter of what one can incorporate in their day. There's a ton of different apps out there as well for monitoring activity. So one example here is Moves, which identifies number of steps that someone takes, how many minutes of cycling and running one engages in. And this is an app that's downloaded onto your phone, and it's just this visual representation. There's also a map that shows where you've been throughout the day, but it gives that feedback that people may need to feel competent, to build that competence and self-efficacy for exercise. And then there's apps to identify if someone wants to engage in sports, instead of, try to find a sport activity throughout the GTA or the Toronto area, for example. This would be if there was a soccer game that could be a drop-in. You could find it located based on the app, and you could go and join in with other people who are engaging in sport. And then there's a number of apps that are related to building rewards for the number of steps you take. So similar to the example of the walk or the book that opens up as you walk more, these are also apps that you can gain, so you can run or walk and build charity miles, for example, or you can earn your own whatever your favorite points are. So anything that you build on yourself throughout your day-to-day, you can also incorporate exercise, which then builds more and more points for you. So these are just examples, again, of different apps that are out there. And just to highlight that there is a half-life of fitness trackers. So, ultimately, fitness trackers in general are used. Some people, it's a matter of finding the one that's good and that's right for you. And there's a whole host of them out there. Typically speaking, individuals tend to download a number of fitness trackers before they find one that's right for them. But it is a matter of sort of trial and error in terms of finding the one that's tailored, that's the most specific to what you're looking for fitness levels, for self-monitoring, for building that idea that you are engaging in exercise, or for information like the Nike Training Club app, which actually gives the routines for you. So there's a number of different capacities out there for exercise trackers. Okay, so the main takeaway messages really are to make sure that when we're talking to clients and patients about exercise, that we're trying to build this sense of autonomy and discuss competence, so being able to help individuals improve competence. We also want to make sure that we're dispelling the myth about exercise, and this means to foster different levels of quantity, types, and that main message of moving more as well as sitting less to be able to improve mood. So why is all this important? Again, I'll just highlight for you that same image, that there's a whole host of diseases and illnesses that are tied to physical inactivity. So it is important. It's especially important for individuals presenting with mood disorders, because ultimately we can help offset not only the mood disorders themselves, but also the range of comorbidities that are associated with them. So what's the evidence? What does the evidence suggest? And I'm just going to highlight a few main summary or meta-analyses for you on the benefits of exercise in the literature. So if we compare exercise to nothing, ultimately to no treatment at all, what we see is that exercise is better than no therapy for individuals presenting with mood disorders. And this evidence is predominant for people with depression in particular. So there is an effect, a moderate to strong effect for exercise when we compare it to no therapy at all. And this was a systematic review, Cochrane review, conducted in 2013. When we compare exercise to antidepressants, what we see is that exercise is no better than antidepressants, but it's also no worse. And so this is a key to what we see, is that in general the literature demonstrates, some studies have shown there is an effect and some studies have shown there is no effect. However, in general, what's critical here is that exercise has very few side effects. It has very few costs associated with it, and a tremendous number of benefits. It's cost efficient and highly beneficial. And so that the fact that it's no worse than antidepressants is critical. And then when we compare exercise to a range of other therapies, so anything from cognitive behavioral therapy to mindfulness, relaxation type therapies, or any other active controls, what we see is that exercise, it may be better than active control conditions like meditation and mindfulness. However, there is no difference between exercise groups who exercise versus groups who are engaged in cognitive behavioral therapy. There are additive effects for both exercise and antidepressants, and exercise and cognitive behavioral therapy produce sort of some of those strongest effects that we see. However, when compared in and of themselves, the exercise groups and the CBT groups are no different. Again, the benefits of exercise in terms of overall host of other physiological, psychological, and social systems speak to the fact that it is that cost-effective mechanism that can help with mood disorders. And this is just a diagram to sort of demonstrate that. This was a review of exercise for depression comparing active control interventions with no treatment or placebo, and just in general identifying that on the Beck Depression Inventory, the scores in general fell in favor of the exercise group for those different conditions. So this is just one of the many articles that I've just been using to present that information for you. So the bottom line is that exercise does no harm, and if we can change the lens towards looking at exercise more generally as moving more, the lighter intensity exercise, the exercise that people enjoy, then we will be able to hopefully be able to help more people engage in exercise, which would then help offset the mood disorders as well as the number of other health comorbidities. So I'll just end the presentation with a few different slides on the evidence that we have in our Mental Health and Physical Activity Research Center. In general, I'm not going to present the whole host of studies that we've conducted over the years. However, I'm going to highlight for you that we've done work in the area of university students, in youth, in cancer survivors, and other clinical populations, as well as individuals presenting with obesity. So a range of different populations where we study mental health and physical activity. And this is all stemming from our work with students in particular, stems from the ACHA-NACHA data that demonstrates university students' levels of symptoms related to anxiety, depression, and panic attacks, which are highlighted on the screen here, as well as a whole host of other diagnosed or treated conditions. And what I just wanted to draw your attention to is that the highest diagnosed aspects of the students' day-to-day lives relate to panic attacks, depression, and anxiety, if you look at the rates of diagnoses or treated. So there is a definite challenge associated with mood disorders related to university students in particular. And this, in Ontario, there was a headline earlier or later in 2016 that identified this need that Ontario campus counselors are ultimately drowning in mental health needs. And so it demonstrates for you the lens of, the extent to which students are coming in with diagnosed professionals, and it's a challenge for us to be able to identify how to help manage what's happening on university campuses. And so for us at the University of Toronto, we are working with the health and wellness at University of Toronto and helping to refer students from health and wellness to a physical activity program that we offer in our lab. And this is ultimately to identify students who are sort of in this reacting or injured phase of the student mental health continuum, to see if we can, if they engage in an exercise and behavioral counseling program, if we can reduce the need for these students to go back to health and wellness. Ultimately, that's our goal. So we call this our Move You, Happy You intervention, and it is a behavioral counseling and physical activity intervention. And what we see, these were data that were the first 22 students that came through our program. And the darker blue is our pre-test scores, and the lighter blue are our post-test scores. And what you can see is that the scores have changed in the capacity that we would want based on a 6-week program. So a shorter, tailored physical activity program. And what we tend to see, and if I just highlight the two here, that anxiety symptoms have gone down and depression symptoms have gone down, as well as this sense of loss of control. We also see quality of life improves and life satisfaction improves. So these are all in the direction we would have expected in terms of the benefits of a short, tailored physical activity intervention for students who are referred to us from health and wellness. We also see, based on this program and anecdotal evidence from the participants, that students generally believe that they understand the benefits of exercise, that their students, especially those who are on antidepressants, have demonstrated to us that they're open to alternative approaches to treat depression, which include physical activity. They also think that the referral to this participation, this program, helped facilitate their own interest and engagement in the program, and they enjoyed the supervised one-on-one training, although suggested that they may over time be interested in small group training as well. But the one-on-one supervised exercise program was important for these students. They also liked that there was alternative exercises. So the exercise program is tailored to their interests and their needs to build that sense of enjoyment. And they also identified that the behavioral counseling that we provide around things like goal setting, self-monitoring, social support, self-talk, that some of those elements of the behavioral counseling that they may have preferred that those were given to them at different times throughout the program rather than sort of all incorporated every week that they came in. But generally speaking, interest in the program, you can see the effectiveness of the program based on the pre-post test scores of these students. And I'm just going to flip through these slides just to end with a sense of identifying why there are these effects of physical activity on mood. And I'm not going to go into details of each of these mechanisms or these theories. However, just to highlight that there's a number of mechanisms that range from anything from the fact that physical activity provides some level of coping or distraction, that physical activity's effects on the endorphins, monoamines in the body, as well as the HPA axis, that with it helps improve the function of these different mechanisms in the body, and that these in turn are related to affect and mood. We also see that hypotheses related to mastery, which is what I've tended to focus on today in terms of building competence, and having those goals that are manageable to build competence, and that in turn builds a sense of improved mood. And social interaction, which is what we've already talked about as well today, the importance of building those social skills and that social element of physical activity. So there's a number of different mechanisms that we understand in terms of the benefits of physical activity on mood that are prevalent in the literature. So as I've highlighted already, but I'll come back to it again, the advantages of physical activity are ultimately that it's very little cost. There are no side effects. Ultimately, the benefits are far-reaching outside of or beyond mood and affect and the psychological disorders. There's a whole host of comorbidities that are associated with physical inactivity that we can help. And physical activity is self-administered, so it ultimately comes down to the person. There's no other individuals that need to be involved in terms of engaging in physical activity. Of course, as I already mentioned, there's also physical health benefits. So at the end of all this, what is the best exercise? I'll just end it with this last slide here on Dr. Chuck Hillman at the University of Illinois does a lot of work in brain imaging and physical activity. And this is ultimately what a brain looks like. On the left-hand side, quietly sitting, and on the right-hand side, a brain after 20 minutes walk. And so you can see, going back to those mechanisms of change, there's a whole host of elements within the brain that we also haven't fully understood in terms of the benefits. But this picture is walking. This is light intensity exercise and the benefits. And so the best exercise is ultimately the one that your client or your patient will do. And this has to factor into enjoyment and interest, their level of ability, what they choose to do. The low intensity tends to factor into all of those elements, and based on the environment. So if one can engage in exercise in different ways or in different places, then that's the sort of depicts or detects the best exercise for the individual. So it has to be an equation that relates to what they can do, what's provided for them in the environment in terms of cost, in terms of what they can actually engage in, and to dispel that myth that what exercise is, and ultimately to help individuals move more. So I'll end it there, and I can take any questions that anyone might have. I'll also put up a list of some of the references that were used throughout this presentation, and I can wait for some of the questions that come in.